Hi, so I'm here to perform an airway clearance device. So the device that I'm going to give to the patient is an acapella. So before that, we always have to check the patient's chart, and then once going inside, we introduce ourselves and what's the purpose of this, and then explain to the patient. And then at the same time, we assess the patient, obtain vital signs, and then at the same time, we have to check the ID band to ensure the correct patient. Then after that, we have to wash our hands, wear appropriate gloves, and then we think we can start performing to the patient. So with this one, we make sure that we set the appropriate flow to the lowest one and in the negative side initial trial, especially if we started it with an elderly patient. And then when we started this one, we have to make sure that the patient's elbow should be relaxed, comfortable, especially being laid down in a table. And then when they hold this one, make sure that they hold it like this. It should not obstruct. And then when performing this, we let the patient take a deep inhalation and then do a forceful exhalation in this device. And then when they exhale to this device, they will notice an obstruction, and then once they sense an obstruction, they should continue it until such time they feel they empty their lungs, and then they remove it. So when performing this, they can do this about 3 or 4 times, about until 8 times. And then if they feel any dizziness or any lightheadedness or nausea, we should stop the therapy to prevent any complications. So assuming I started it to the patient, so I already explained it to them that this would help them clear up secretions, clear the airways, prevent or reduce any atelectasis, and then we should do this position like this in our patient, and then let the patient inhale and then exhale. And then if they sense a obstruction, they should continue it until such time they feel their lungs are empty. Remove the device and then let the patient cough. If you sense a patient have any secretions present, if we've got a basin in place, we can put it in front of the patient so that they can expectorate there. So that way, if the physician would like to obtain a specimen, we can either have a specimen cup in place just in case. And then another thing is that we did it to a patient using a mouthpiece. If some situations, such as the elderly ones, were not able to tolerate using the mouthpiece, we can also use it with a mask. And then when doing this, it is ideally to perform this every after nebulization, especially their secretions are being loosened up. And then they can use it also when they are at home to practice it, and then it would able to help and aid their cough reflex. And then when doing this, it should not be blocked, so that in that way it will prevent blocking the flutter valve. And then it is also not indicated to do this together or synchronized together with the nebulization, because it might lead to clumping on the flutter valve. So once we're done, we also have to educate the patient that this one should not be soaked, should be laid down and air dry. So we have a safety bag in place in here with its patient's name, room number, date of birth, and then the mouthpiece should be covered with a clean tissue cloth, then included that put inside in here. And then once everything is done, we have to reassess the patient. We should be able to sense and document, including the color, consistency of the sputum, and then the patient's level of consciousness, the SpO2, and then we auscultate it if the lung sounds are already clear. And then once outside, we document it. We should explain it to the physician if present, or the nurse station, if what we observed while performing this therapy. And